Hey everybody, John Millen here with Benefit Hackers. I am extremely excited to highlight an RVA business hero organization and hero people as well. I have Paige Carpenter and Daphne Marshall. They are with Blue Ridge Senior Living of Richmond. Ladies, thank you so much for being on the podcast.
Thank you for having us.
Absolutely. It's an honor to be with you today.
Now, there are so many cool things that we can talk about, but first, obviously, you both are wearing very stylish masks, I must say.
Thank you.
Yes.
So tell us first about Blue Ridge Senior Living of Richmond. Tell us a little bit about your organization. So people that might not have heard of you, where are you located, and tell us a little bit about you.
So, Blue Ridge Senior Living, we're located at 12411 Gayton Road. Blue Ridge Senior Living is ales out of New Jersey and North New York. So our owners and operators had the vision of taking this community and turning it into a 5-star community, but still very elegant and simplified with the pricing that we can offer to families.
Excellent. Now, approximately, how do you measure the size of your facility? Is that a regular question you get from people?
Yes. So we are licensed for 140 people. We are 3 floors. We also offer memory care, which we can, as part of that 140, our max is 20 in our memory care at this time. So we're a fairly good sized community.
That's excellent. And you're right there on Gayton Road. Is that correct?
That's correct.
Yes.
Right in the far west end.
It's really
Excellent.
located to shopping. We are shopping across the street, and we're just minutes away from Short Pump Town Center.
Fantastic. Okay, so when I visited you all a couple months ago, before the COVID coronavirus broke out, I noticed there was a lot of construction going on, and I was able to see a little bit about what you're doing and how much you're putting into that facility. Do you guys want to talk about that? Because I saw the before and after. Tell us more about what you're doing to the facility itself.
Absolutely. We're doing about less than 50% of the community. We're sitting in an actual apartment that you see here. We offer different sizes of apartments ranging, they're all studios. However, we do have some that are private rooms with shared baths. We've renovated the rooms as we have folks that we've been moving around. We are renovating around, the community is half full here. So we're having to move folks and relocate them. But as far as the renovations, we're looking to implement a brand new dining room where we offer our fresh culinary experience through our Nourish program here. We're putting in a brand new lobby area, new offices, a salon, which everyone loves the salon. We'll have a bistro as well. So, and the corridors are nicely appointed, nice and wide hallways. This is basically a 40-year-old building that really, it needed that tender loving care and to be brought to the 21st century for sure. Mm-hmm. So that is our goal, to do that. But again, offering it at a very good price for families and a good option here in the far west end. So they're just some little helpful hints.
Yeah, no. I've been through this experience with my mom and dad. My dad still lives in Pennsylvania, and this a couple years ago, we were thinking of bringing him down to Richmond. This is probably 3 years ago. And I remember visiting facilities. Some of them were very nice, and some of them were not as nice as he wanted. So the fact that you're investing that much energy into that, I know is a big deal to grow into the future. And what's really impressive is you're doing it in the middle of a global pandemic. Yeah. You're operating. I think that when Deborah Willis and I talk, who's one of my business development managers, when we talk about you guys, it's just mind blowing. How in the world can you have a construction zone and take care of patients in the midst of a pandemic? Paige, tell me about, from a leadership perspective, how do you manage those projects effectively?
Well, it really just comes down to, following what I've been doing is following following the science. I don't get into the hype. I don't get into well, he said this or she said that. I try to follow the science. I have to pull my mask down so I can talk because I can't breathe and talk and all that.
Yeah, we don't want you passing out.
So, what I do is I just try to listen to what the science says and what the CDC says. And what I've done is we started really early, and I think that has been a key for our success. When we first heard about the virus, and there's a good chance it's coming to the United States, and it can be wherever it is in the far part of the United States, we locked down early on. And I remember the day, I mean, we had a meeting and my team and I were together and I said, get the signs made for the door, get the signs for the front desk put up. We've got to move a table out. We've got to stop this by noon tomorrow. There's no more visitors. And we just kind of said, these are the rules everybody's going to follow. We sent out a letter to all of our families and explained to them early on what we were doing and why we were doing it. Nobody else had shut down yet. We did. And all of our...
So Paige, can I ask you a question? Sorry to interrupt you. It sounds so easy now when you say it. Oh, I just locked stuff down. But in the moment, and you just said no other facilities were locking down. Did you get pushback from the residents, from families, from employees? Did you get any pushback?
We did. I mean, they didn't understand. It was not so much pushback. It was like, why are we doing this? What's going on? And there was a little bit of confusion. But when you have a solid team behind you and we're all saying the same thing, we're very fortunate that our owners are really invested in doing the right thing. And so they have experience out of New York. And of course, New York was absolutely just the hotbed. And we took our cues from them. This is what we're doing. This is what we have to do. And we learned a lot from them. And as they fed us information, we implemented it. And we told families it's for your safety and well-being of your loved one. It's not because I'm trying to be mean. I'm trying to keep your loved one safe and alive. And that's exactly what I said. I'm keeping you safe, out of the hospital, and alive. And
wow. Now, Paige, you were drawing on, I believe, a long history of positions in healthcare and leadership roles. Mm-hmm. Do you think that prepared you in that moment to reach out to the owners and say we need to do this before anybody else?
Well, I like everybody else. I've never been through a pandemic. I didn't know what to expect. I didn't know, but as I said, I was listening to the science. I was listening to the news. I was listening to, because I read a lot of medical information. I try to stay current on what's going on. And when I heard, well, so-and-so in California might be locking down. Oh, it's coming. I was like, no, we're going to do that because I got to keep these people alive. I got to keep them well. My team, it's not just residents. I have residents and families to think about, and I have staff and their families to think about. I have my own family to think about. So we just all got together and said, this is what we have to do. It's not optional.
Wow, that is such a great story because I was just watching the news last night and something about Florida. When Florida got wind what was going on, they attacked their high-risk areas first, which I believe were the assisted living, nursing homes, communities. They realized, okay, and it's very similar to what you did locally, because there were some organizations, unfortunately, in Richmond that had some issues, and it was sad, and it affected a lot of people. Daphne, from your perspective, did you get any pushback from families saying, I need to come see my dad and my mom? And how did you handle that from the external family perspective?
Absolutely. We certainly did. And even from an admissions perspective, you seem to see that people were making decisions based on, oh, I don't want mom to move in there because I won't have access to her. Where truly this is the safest place for someone to be during a pandemic, truly, because they're still getting that socialization through how we were delivering meals to the rooms, and the activities we're still doing daily and throughout the day to each and every room to provide those activities and that stimulation, and really just using our technology. And I think that's something that sets Blue Ridge apart. And the owners took very selective paths in who they were employing for this community. They wanted dedicated professionals that strive to make a difference in the lives of the people they serve every single day. And they chose seasoned folks that certainly have a lot to bring to the table as far as being able to keep things at how do I want to put it? Keep things very organized in this type of a situation, and not, to Paige's point, really go into the hype of something. So I think with them seeing the calmness that we brought did help with the pushback that we did get. And certainly it was very, very difficult for families to think of the possibility of not being able to see their loved one, but we made provision for that. We utilized, our technology in bringing those, what were they? FaceTime things.
Duo,
yes.
Zoom meetings,
Right.
phone calls, all of those kind of things. And I did what was called, I've been doing it every month. It's called State of the Community. And I send out a letter to the families, and it's called the State of the Community. And in my letter, I just talk about, here's what we're doing, in the community. Here's what, the CDC guidelines are telling us. Here's what we're following. This is why we're doing it. If you want to have a Zoom meeting with your loved one, call this number, get in touch with our activity director. If you want to do a FaceTime, what's the best number to call? Emails, letters. And I will tell you that there has been an outreach from the greater community, from churches and from organizations, making cards, sending letters, making posters, doing parades outside, drive-bys. So the greater community has just been absolutely amazing during this time. So, where some people may feel like I'm so distant, I feel like, I'm sorry it took this, but I feel like this has brought us together as not only an assisted living community, but with the greater community at large.
Absolutely. And what it's done is, I would think, it's given you a tremendous amount of experience in a crisis situation that no one wanted. But from a facility, Daphne, you said this is the safest area your loved one could be. And I think that is a point that you guys over time could drill into, because naturally my first thought is that's not the safest place, but you could then overwhelm that with evidence. We do this, and this. Do you think your procedures will be changed permanently, or some of them, from this?
Absolutely.
Yeah.
Absolutely. We're meeting weekly on being able to roll out an opening of this community, because we probably more than likely will be one of the last places to really open up and allow free reign into the community with visitors and that. But we truly have to look at what is the traffic that's coming in and evaluate different marketing people coming in, for instance, and all the home health companies that come in, and really start streamlining those services, because you do want to minimize traffic and you want to minimize the risk at large. So this is definitely changing the face of the way we do business every day, for sure.
Very much so.
Yeah, if nothing else, I think it's transformed a lot of industries, even for us in the employee benefit industry. We're doing things differently, so it's pushed us in different areas. It hasn't swung the pendulum for us. We still have our mission. We still know where we go, but it uncovered some needs for some other things, which is actually kind of cool, because it's going to help serve people better in that process.
We hear, everybody says, well, when are we going to get back to normal? When are we going to go back to doing what we used to do? And my personal philosophy is, I don't want to talk about going back. I want to talk about how do we move forward. And that has to be the dialogue. You know, I don't want to, you know, you hear the old adage all the time, why is your windshield much bigger than your rear view mirror? Because you're not going that way. You're going that way. You're going forward. So I want to think about how we're going to move forward. I don't want to think about how to go back.
Wow, that's excellent, Paige, because I keep hearing the phrase new normal. What's the new normal? And I understand what they're trying to say, but part of me doesn't like it, but part of me doesn't also like going back to the way we were either. And I think that's a great perspective, especially in your industry. Your industry is not one that can't change. It has to evolve and get better.
That's
right.
Yeah, very much
so. Very much so. So let me ask you, pivot a little bit to your employees and your workers and the people that are working through this. What have you found their response has been, and what have been some of the challenges maybe with your staff and employees through this process that maybe surprised you, or maybe in a good way, maybe surprised you on the upside, but maybe some things that you learned, hey, we got to get better at these things going forward?
You know, one of the things that I thought about early on was, you know, we were hearing all the early reports about, especially in New York, about staffing and how just crazy it was there, and lack of staff and staff not wanting to come to work and that kind of, because of fear. And I kept waiting for the shoe to drop. And then I kept waiting for the other shoe to drop. And I kept waiting for the, oh my gosh, what are we going to do? I'm going to have to come in and I'm going to cook. And that would be a disaster for everybody. You know, that would just not be good.
We don't want that. Yeah.
No, we don't. No, please ask Deborah. She'll tell you.
Keep you out of the kitchen.
Yeah, please keep me out of the kitchen. Unless you want me to pour your morning coffee, then I'm really good at that.
Very good.
But I just kept waiting. And John, I have to tell you, thank goodness, at a huge surprise, it never happened. My staff came to work every day. My staff came in, they stayed late, they worked over, they picked up additional shifts. And, you know, we did have to monitor who was working other jobs. And we decided for employees that had been working for us and for somebody else. And we kind of told them, here's the rule. You know, I know you're working full time for me and you're working part time somewhere else. And if that somewhere else has a case, then you can't come back here. I'm sorry. That's just the way it has to be. And in 2 instances, they stopped the part-time job and worked still full-time with me. And so it just meant an awful lot. And they have been amazing. There's no other words to tell you. They have been amazing. So I'm very, very, very proud of the staff that we have here and their commitment to these residents. And I'm on them every day. Are we taking temps? Have there been any change in symptoms? Have there been any coughs? Everything. If somebody has a hangnail, I want to know about it. And so I think that's it. It's a testament. These guys have been great.
That's awesome. So Daphne, I want to ask you a question. So,
Sure.
What do you think has been the biggest thing you've learned, or the biggest takeaway that you've experienced over the last two months or so?
Wow, that's a great question. I think that people coming together to truly show why you're doing what you're doing each and every day, I think that's made the biggest impact. And I think it's also really brought our community together, and it's so much more of a family atmosphere. I think that's even happening in the whole world. I mean, families are being forced to be together now, and children are with their parents. And I mean, I just see that this has had a lot of good, it will come out of this. And I think it will also, I think something else I've learned that's really been impactful to me is that we can still all be connected at all times. A lot of times you're so disconnected from family members or disconnected from friends, and it makes you really cherish and appreciate those relationships that you do have. I think I think there would be a lot of really good come out of this from that perspective, for sure.
That's excellent. You're right. I mean, the fact that we're communicating on a Zoom call, Zoom has been around, these telebroadcasts have been around for years.
Yeah.
And now people are connecting, not just in this setting, but mom and dad, brothers and sisters, and so forth, employees. So Paige, what would you say? What was the thing that is your biggest surprise or takeaway from the last 2 months or so?
I think probably the greatest takeaway is that just to cherish every moment and to be grateful. Just doggone it. Get up in the morning and be grateful. Because so many people say, "Oh, I can work." 35% of the American population can work from 34%, 35% can work from home, and there are those of us that can't work from home. And boy, am I glad that I can. I get to come in here every day and see my residents. I get to see my staff. I get to eat my food that my chef cooks. I get to be a part of this. So, this is my takeaway. Just be grateful. Be grateful that you have friends and family and colleagues, and, that you can do a Zoom meeting. I mean, up until 2 months ago, I didn't know Zoom from Zip. I mean, come on, and now it's a part of my everyday language. So just be grateful. Just be grateful. You have a job and you have friends and you have colleagues and you have a way to communicate. And that's what I would say.
Those are great words from both of you, because there are a lot of people that don't have anywhere to go. They don't have any job. They don't have any income, or business owners that have no business. They have no income. They're laying off everybody. They're foreclosing. So yeah, there's something to be said with, hey, I'm in an environment where I'm still helping people. I'm doing worthwhile work. I'm taking care of people. I had to make some adjustments to how I operate, but it's a global thing going on, right? It's not just a local thing. This is a global problem. And so I have one final question for each of you. And I'm always curious why people get drawn to certain industries. So Daphne, I'm going to ask you first. Why do you work for an assisted living? Why do you work in this industry?
Well, it's a great story. At least I think it's a great story. Hopefully you all at home or whoever's watching this thinks it's a great story. My grandparents ran a retirement community called Kamloops out in Tucson, Arizona. And my parents and I, we were in that area on deputation. My family was missionaries to Germany, to the American military there. So we would go out there and spend summers when we were back from Europe. And I would get to sing for the residents and get to talk and be with all of my grandmas and grandpas, I like to call them. So that it was just so impactful for me to be able to touch those residents and see them smile and say, "Oh, honey, we love your voice," and just have that connection. And so I told my grandpa, I said, "Grandpa, this is what I want to do the rest of my life. I want to sit at the feet of wisdom every single day and hear their stories and just share my life with them." And it makes me cry because I'm sorry.
That's okay.
That part,
no, it's real.
But it's very real. And my grandpa said, "Well, no, you're going to be on a tour bus like Loretta Lynn." And I said, "Yeah, I'd love to do that too." But just being able to see them smile. And, these people, and this is my heart, truly, these people work all their lives for and plan for this type of a lifestyle. And they deserve the very best. They deserve the very best. And that's what we bring every single day, is our very best.
Wow. Thank you for sharing that, Daphne. And it's okay that you're emotional, because usually people that I've learned in that industry, there is a motivating factor more than just a paycheck.
Oh,
right?
For sure.
It's usually much deeper.
You don't do this for a paycheck. It's way too complicated.
Yeah.
You're dealing with people every day that have problems, and you're listening to stories that you can't write, but to be able to help them navigate this process and truly connect with those families and tell them, look, I'm going to care for them just like if they were my grandmother or my grandfather. And you can rest assured that's what we're here to, and we're dedicated, and we love these people. We grow to love these people.
And that's what people need to hear. when they're like me 3 years ago, bringing mom and dad down, and dad's on the internet looking at how fancy the pictures are. I'm like, Dad, I need to go visit and talk to the people. He's like, okay, yeah. They need to see what's behind the fancy front door or the brochure or the website. And I think you're going to get both with you guys. Not only you get a really nice facility with all the cafes and everything else you mentioned, but also the people behind it, which is so important.
Yep. Well, we tell people that we aren't selling real estate. This is the core of what we do here. And if you look at that acronym, CORE, it's care over real estate. That's what you're looking for. You're coming to this community for the care and for the people. And, yes, we're going to have this beautiful renovation, but it could be cold and steely, just like the walls that we're painting. But it's the people and the atmosphere and the feeling. That is what people look for whenever they look to connect and come into a community like this. And not every community has that. And so we tell families, you have to come out and meet with us. You need to come and sit down, and you need to feel the atmosphere. And that's one thing that COVID has really been a challenge, because we miss that. We miss that, making those type of connections. But we're very excited to move everything forward and do what we can to serve. And that's really what you need, a servant's heart in this business.
Daphne, thank you so much. That's perfect. That's the exact message. So Paige, what about you? So what draws you, or has drawn you, or is drawing you now towards this line of work?
Well, I have always, and this is really personal to me, and it's a great question. Thank you for asking it. But, I've always been a believer that you should always play to people's strengths. Okay. So as a leader, my thing is always to, have leaders and have people do what they're really good at. Right. So just like we were laughing a minute ago, you wouldn't want to put me in the kitchen and say, you're in charge of dining, because I can cook. I have a brother that's a chef, but no, I didn't get that gene. But the gene I got was, I have a really, and I know this about myself, I have a really big personality, and I love to talk, and I love to make people laugh. And I like to see things grow and change. And I like to make people happy. And I know that about myself. So I never made it to Hollywood because I missed the bus. So I figured, how can I use this big personality and my desire to make people happy and smile? How can I use that? And when I started out in my career 100 million years ago, doing nothing that had anything to do with what I'm doing now, I learned that I want to make people happy and smile. And I'm really good with older people, with seniors. And I just fell into it, if that makes any sense. And when I started out, I didn't even know how to spell Medicare. Okay. And I found out through working in long-term care and doing exactly what Daphne does, sales and marketing, that I could use my business sense and I could use my personality and I could run a community. I didn't have any intention of being an administrator. It was not on the to-do list. But when your boss calls you in and says, I think you'd make a great administrator, and you go, no, that means I have to take a big test. No, you're going to be great. The next thing I know, I've got this license and I've got this community, and I get to use my big personality to do all the things I love to do, especially making seniors smile.
Wow, that is so well said. You both are so well spoken and so sincere. This has been a really fun interview for me. Partially because I know you as clients, but partially it's deeper than that, right? It's not just that, it's hearing about you from Deborah for so long, and then meeting you in person, and then seeing your staff, and then seeing what's going on with your facility, and then having my experience with my dad, right? It's all coming back to me. And I think you guys are well positioned to be one of the premier locations. And I would tell you this, if my dad ever decides to move to Richmond, someday he might. We put it on hold for a little bit, but if someday he might, we're going to come see you guys, because I think what I heard about your care and compassion and your core. I like your core.
Yep.
Care over real estate. That's
right.
been awesome. So Paige and Daphne, thank you so very much for being on the podcast. We wish you the best of luck, and hopefully things will open up a little sooner for you, and we can get back to the future, Paige, not the past and not the new normal, but we'll get forward.
Absolutely. Thank you for having us.
Thank you.
Bye-bye.
Thanks so much. You guys have a great day.
Bye-bye.